What is respiratory alkalosis? Imagine becoming suddenly scared and going through the fight or flight motions. Your body will experience certain symptoms, and hyperventilation is one of them. Breathing rapidly causes respiratory alkalosis, which is the elevation of blood pH. Normal range is anywhere from 7.35 to 7.45. Alkaline and the carbon dioxide levels drop too low. Hyperventilation is one of the main factors to produce this condition, but there are other underlying factors that cause this to happen as well. Over here we have a picture that shows all kinds of reasons why respiratory alkalosis can occur. You have seizures. There are things that can happen because of it. Lethargy or confusion, lightheadedness, nausea, vomiting, deep rapid breathing, hyperventilation, tachycardia, lower normal blood pressure, hypokalemia, numbness and tingling of the extremities. The pathophysiology of respiratory alkalosis. Right here you have the numbers that I just mentioned, normal and acid base. And this is what you would find in a blood sample that you would get from an arterial blood gas. It says the respiratory system usually keeps these two gases in balance. Respiratory alkalosis occurs when you breathe too fast or too deep and carbon dioxide levels drop too low. This movement causes the pH of the blood to rise and become too alkaline. When the blood becomes too acidic, respiratory acidosis occurs, which we already went over. Risk factors. So, things that can occur due to this: heart attack, pain, drug use, asthma, fever, COPD, infection, and pulmonary embolism and pregnancy. And some of the manifestations, things that can happen as a secondary effect due to one of these risk factors, is dizziness, bloating, feeling lightheadedness, numbness or muscle spasms in the hands or feet, lightheadedness, anxiety, and chest pain. Chest pain is sometimes confused for a heart attack, and it might not be. Assessment for respiratory alkalosis. Here we have a 16-year-old female with sudden onset of dyspnea. The patient was admitted to the hospital for numbness in hands and feet. Patient's chief complaint: I feel like I can't breathe and there's not enough air in the room. An exam called the arterial blood gas is performed to test respiratory alkalosis. The doctor will then be able to decide how to diagnose this patient. The blood is taken from the artery and will then be placed in a special machine that will interpret the acid-alkaline content in the blood. The vitals at 0900, as you can see right there. Everything seems pretty much normal. The only thing a little bit low would be the O2 saturation, and the respirations are high, indicative of hyperventilation. Patient denies chest pain at this time. Patient states, I feel like I'm going to pass out. My hands are tingling and my feet hurt real bad. There is an IV axis. That is the lab work right there. Glucose check came back at 85, which is fine. Hold on 1 second. Okay. Neurological status of this patient: alert and oriented ×4. Complaining of, I am feeling faint at this moment. Muscular activity: patient appears to be rigid due to lack of O2. Reaching the extremities because of an accelerated breathing pattern. Cardiovascular: rapid heartbeats as patient presents with tachycardia. Respiratory status: patient has rapid, deep, and shallow respirations. Oxygen is given via nasal cannula at 5 liters per minute. GI: slow, reflex intact. Skin diaphoretic, face appears red. Skin very warm around neck. Patient is clammy. In psychosocial, patient takes medication for severe panic disorder, and the patient takes her medication daily but drank a lot of alcohol last night. So alcohol is a factor that can cause panic attacks the following day. Compensation regulation: when chronic respiratory alkalosis happens, the kidney decreases the H secretion, which produces a decrease in the serum HC3O concentration. Metabolic compensation for a respiratory alkalosis develops gradually and takes 2 to 3 days. In chronic compensation, plasma bicarbonate fails by 4 for each 10 mmHg, decrease in the PCO2. When respiratory alkalosis is a medical condition in which increased respiration elevates the blood pH beyond the normal range, with a concurrent reduction in arterial levels of carbon dioxide. And here we have some nursing interventions that we can do. We monitor the respiratory rate, depth, and effort, asserting cause and hyperventilation if possible. Differentiate hyperventilation caused by anxiety, pain, or improper ventilating settings. Because as we spoke, panic attacks can be a false alarm for something major. So it's asking to differentiate what's causing this hyperventilation. Is it anxiety? Is it pain? Is it something serious? And the rationale behind that is just to identify the alterations from usual breathing pattern and influences choice of intervention. Could be a drug-related indication. We don't know, so we have to differentiate. Encourage patient to breathe slow and deeply. Speak in a low, calm tone of voice. Provide safe environment. And then the rationale is may help reassure and calm the agitated patient, thereby aiding the reduction of respiratory rate, assist patient to regain control. What you never want to tell a patient who's going through this is to calm down. That's never the way that we speak to a patient, because that might just agitate them even more. But you do encourage them and try to comfort them as best as possible. Assess level of awareness or cognitive and neuromuscular status. Assess strength, tone, reflexes, and sensation. Decrease mentation, mild to severe, and seizures may occur when alkalosis is severe. That's the rationale behind that. And that is it for respiratory alkalosis.